In this peak of development, teenagers are in the era of finding their self-identity, and this impacts to their high level of curiosity. Free sex is defined as having sexual relationship before marriage or sexual relationship done by changing partners. This behavior or lifestyle is commonly done by teenagers and is diminished only as a behavior that shouldn't be done just because it is not the right thing to do. However, free sex actually impacts our quality of life, especially the health of the moms and the babies. According to WHO, teenagers or adolescents are people aged 10 to 19. In this age span, humans are in the peak of development psychologically, physically, mentally, and intellectually. In this peak of development, teenagers are in the era of finding their self-identity, and this impacts to their high level of curiosity. This high level of curiosity invites teenagers to explore more about their world, including about the development of their reproductive organs. This leads to the phenomenon we know as free sex. So, where does it lead us? There are three bad impacts of free sex related to health. The first one is, the act of free sex induces sexually transmitted diseases such as HIV/AIDS, syphilis, herpes, gonorrhea, and more. This, of course, endangers the health of teenagers, male or female. Some of the diseases can even be transmitted to babies if they intend to have one. Second one is teenage pregnancy increases the number of neonatal deaths. Physically, teenagers' reproductive system are not ready to ideally fertilize and nurture a baby. The reproductive system is still on the maturation process. The sperms and eggs have just started beginning to mature, and the uterus wall is still not strong and big enough to nurture a baby. Psychologically, teenage pregnancy is labeled as a shameful thing, leading to social pressure towards the teenage mom. This is why most teenage moms decided to do abortion. Moreover, abortion because of pregnancy before marriage is also bad in the social stigma and is tightly regulated by the government. This will lead to teenage moms aborting their babies in uncertified clinics or physicians without adequate competence. This, of course, will have a bad impact towards the mother's health. This leads us to the biggest question: how to prevent health impacts originating from free sex? The government has set a target in the Sustainable Development Goals in which related to teenage pregnancy is to decrease the fertility rate of adolescents aged 10 to 14 and 15 to 19. Regulations regarding the legal age of marriage has also been made. However, the government can't walk alone. They need us. What can we do? Health-related workers are urged to give information regarding reproduction health in order to give teenagers enough knowledge of their reproductive system. Us, as an individual, has a role to absorb as much knowledge as possible and transmit the information, either through person-to-person communication or through mass education. And us, as the society, need to be a support system for the teenagers, as they are still turbulent and need guidance from all of us. In the end, free sex is not just a matter of bad behavior, it is a matter of health. So, stop free sex and live healthy.